Rape is a heinous crime, one that leaves deep, lasting scars on its victims. It is an act that transcends cultural and geographical boundaries and is an affront to the fundamental right of individuals to feel safe and secure in their bodies. From a medical perspective, understanding rape entails a multifaceted approach, touching on physical, psychological, and societal dimensions. When we speak about rape in medical terms, it is essential to start with the immediate health consequences that victims face. These can range from physical injuries such as bruises, lacerations, and fractures to more severe repercussions like sexually transmitted infections, STIs, and unintended pregnancies. Medical professionals have a crucial role in addressing these immediate health concerns. Emergency departments are often the first point of contact for victims seeking medical help. Healthcare providers are tasked with the sensitive responsibility of offering compassionate care and support during a profoundly traumatic time. One of the first steps in the medical management of a rape victim involves a thorough assessment. This includes a detailed medical history and a physical examination. Victims often experience a heightened state of anxiety, fear, and disbelief, which complicates their ability to communicate their experiences. Providers must approach this process with sensitivity, creating a safe environment where victims feel comfortable sharing their stories. In many cases, victims may require not only physical examinations but also psychological assessments to address their mental health needs post-incident. The forensic examination, also known as a rape kit, is an essential part of the medical response to sexual assault. This examination is designed to collect evidence that may assist in the prosecution of the perpetrator. The collection of forensic evidence must be performed with the utmost care, following strict protocols to ensure that it remains uncontaminated and legally viable. Healthcare professionals performing this examination must have a thorough understanding of both the medical and legal aspects involved. This dual focus ensures that victims receive appropriate medical care while preserving the integrity of the evidence needed for legal proceedings. In the aftermath of rape, victims may find themselves in precarious health scenarios, particularly concerning sexually transmitted infections. The transmission of STIs is a well-documented risk in cases of sexual violence. Medical professionals must be prepared to offer urgent prophylactic treatment, including post-exposure prophylaxis in cases of potential HIV exposure. This treatment must be administered promptly post-assault to be most effective. Healthcare providers must be knowledgeable about the various STIs that can result from sexual assault and the appropriate treatment protocols to follow. Unintended pregnancies are another serious concern tied to cases of rape. Healthcare providers should discuss the available options with victims, ensuring they are informed about emergency contraception and the possible implications of pregnancy that may arise from the assault. The emotional ramifications of an unintended pregnancy, particularly as a result of trauma, can be profound. Healthcare providers must approach discussions surrounding reproductive options with professionalism, respect, and empathy, recognizing the difficult choices that victims face. Psychological trauma is an often overlooked aspect of the medical response to rape. Victims may experience a wide range of emotional and psychological reactions following an assault, including post-traumatic stress disorder, PTSD, anxiety, depression, and even suicidal thoughts. Research indicates that the prevalence of mental health disorders is markedly higher among survivors of sexual violence. This necessitates that healthcare providers not only treat physical injuries but also attend to the emotional and psychological needs of their patients. The importance of mental health support cannot be overstated. Victims may require ongoing therapy or counseling services to help them process their trauma and begin healing. Integrated care models that combine medical treatment pathways with mental health support can be particularly effective. These models emphasize the need for a multidisciplinary approach to treatment, where medical professionals collaborate with mental health specialists to ensure comprehensive care. Furthermore, it is vital for healthcare providers to understand the social context in which rape occurs. Rape is often rooted in power dynamics, societal norms, and cultural attitudes toward gender and sexuality. Addressing these broader issues within a medical framework requires an understanding of various social determinants of health. Providers must be aware that factors such as socioeconomic status, race, and cultural background can influence a victim's experience of rape as well as their access to care. This understanding signals the need for culturally competent care models that are sensitive to the diverse backgrounds of victims. The societal stigma surrounding sexual violence can create barriers for victims seeking medical assistance. Many individuals fear judgment, victim blaming, or disbelief when disclosing their experiences. Consequently, healthcare providers must be advocates for their patients, actively working to create an environment that encourages openness and supports survivors in their healing process. This advocacy can also extend to broader public health initiatives aimed at raising awareness and education around issues of consent, sexual violence prevention, and the specific healthcare needs of survivors. Education and training for healthcare professionals in handling sexual assault cases are paramount. By equipping providers with the necessary skills and knowledge, we can foster a culture of sensitivity and understanding. Training should encompass not only the clinical aspects of care but also the psychological impact of sexual violence. Such comprehensive education will contribute to reducing perpetuated misconceptions and biases that can negatively affect victims during their healthcare interactions. Healthcare systems themselves must also adapt to better serve survivors of rape. Protocols should exist to prioritize the needs of rape survivors, ensuring that they receive timely and competent care without unnecessary barriers. This includes a trauma-informed approach that recognizes the widespread impact of trauma on individuals and promotes a sense of safety, choice, and empowerment during medical interactions. Creating resources such as helplines, support groups, and informational materials can aid in addressing the needs of survivors and guiding them through the available options for care. The intersection of medical care and the legal system is another critical aspect of the response to rape. Law enforcement's involvement, while essential in bringing justice to victims, can also complicate the healing process. Medical professionals play a vital role in navigating these interactions. Ensuring the victim's comfort and consent while liaising with law enforcement can greatly influence the survivor's experience. There exists a delicate balance between facilitating legal processes and prioritizing the individual's needs for care and support. Moreover, the ongoing advocacy for policy reform is critical in shaping how sexual assault cases are handled within healthcare systems. This involves pushing for legislation that protects victims' rights, guarantees access to necessary medical care, and provides funding to enhance training and resources for healthcare professionals. Advocating for comprehensive community-based services that address not only the medical needs of survivors but also their psychological, legal, and social needs will enhance the overall response to sexual violence. Public health campaigns aimed at preventing sexual violence are crucial in addressing the root causes of rape. Education on consent, respect, and healthy relationships, starting from an early age, can promote cultural change and reduce the incidence of sexual violence. Collaborative efforts among healthcare providers, educators, and community organizations can create concerted strategies that foster a safer environment for all individuals. Additionally, Addressing toxic masculinity and challenging harmful cultural beliefs about gender can play a significant role in preventing sexual violence in the first place. Ultimately, healing from sexual violence is a complex and individualized process. With this in mind, healthcare providers must offer care that respects the autonomy and unique needs of each survivor. Supporting the decisions regarding their health, legal actions, and emotional well-being is critical in fostering resilience and recovery. Through a comprehensive medical response that encompasses physical, psychological, and societal dimensions, we can begin to address the profound effects of rape and create a more supportive and effective healthcare environment for survivors. In conclusion, the medical perspective on rape extends beyond the immediate physical health concerns to include psychological well-being and societal implications. Healthcare providers serve a crucial role in this landscape, acting not only as caregivers but also as advocates for change and champions of survivors' rights. Through compassionate care, informed practices, and an understanding of the broader context of sexual violence, we can help empower victims and transform the medical response to rape. This journey demands ongoing education, systemic reform, and an unwavering commitment to changing the narrative around sexual violence, ultimately working toward a society where all individuals can feel safe and respected. Rape, as a profoundly distressing and complex issue, raises a multitude of questions when examined through the lens of religious perspectives. Across various faiths and cultural understandings, the approaches to this devastating crime can differ significantly, illuminating not only the moral and ethical frameworks established by these traditions but also the societal implications and responses to instances of sexual violence. At the heart of many religious narratives is the emphasis on the dignity and sanctity of human life. The principle that each individual is created in the image of the divine lays the foundation for understanding the abhorrence of acts such as rape. Many religious communities assert that such violence is not merely a sin against the victim but also an affront to the community and its shared values. This understanding creates an imperative for religious leaders and adherents to respond firmly and compassionately to occurrences of sexual violence. In the Judeo-Christian tradition, the concept of sexual ethics is deeply rooted in interpretations of the sacred texts. The Torah and the Bible address issues of sexual morality directly, often highlighting the severe consequences of sexual immorality. In ancient Israel, laws outlined in Leviticus and Deuteronomy provide clear guidelines about sexual conduct, emphasizing protection for women and the accountability of men. The biblical narrative consistently portrays the violation of a person's autonomy, particularly through sexual violence, as an act that cannot be justified. The story of Tamar in the second book of Samuel illustrates the profound trauma and societal fallout that results from such acts. Many Christian denominations today advocate for a pastoral response to survivors of rape, emphasizing the importance of empathy, healing, and support. The church is often viewed as a sanctuary, a place where victims can seek refuge and find solace. However, the challenge lies in addressing the often patriarchal interpretations of Scripture that have, at times, perpetuated a culture of silence around issues of sexual violence. Open discussions about consent, respect, and the dignity of all individuals are increasingly becoming part of Christian teachings, aiming to foster a culture that condemns violence and uplifts survivors. In Islam, the Quran addresses issues of morality, family, and the sanctity of individuals with great seriousness. The text presents a comprehensive framework that emphasizes respect for women and condemns all forms of oppression, including sexual violence. The Hadiths, the sayings of the Prophet Muhammad, further reinforce the importance of treating women with dignity and compassion. It is critical to note that within Islamic teachings, consent is paramount, and coercion is absolutely forbidden. The concept of ghusl, or ritual purification after sexual intercourse, underscores the significance of personal agency and respect. Unfortunately, like many religious traditions, interpretations of Islamic texts have been manipulated to justify acts of violence against women, including rape. This has led to misrepresentations and a culture of victim blaming in certain contexts. However, the vast majority of Muslim scholars and communities strongly reject such views, advocating for justice and support for victims. Many contemporary Islamic voices are working diligently to challenge harmful cultural practices and interpretations, striving to create a more compassionate and just response to sexual violence within their communities. In Hinduism, the understanding of dharma, or duty and righteousness, extends to the moral obligations individuals have towards one another. The violation of another's body through acts like rape is seen as a profound transgression of dharma. The epics of Hindu literature, such as the Mahabharata, contain vivid accounts of the ramifications of sexual violence, often portraying it as a catalyst for broader societal conflict. The story of Draupadi serves as a powerful reminder of the deep anguish caused by sexual assault and the urgent need for collective accountability and justice. Modern Hindu thinkers emphasize the importance of addressing the root causes of sexual violence within religious communities. They advocate for education, awareness, and active engagement with gender equity issues, aiming to highlight the sacredness of women and the need for mutual respect. Empowering women and promoting gender justice are increasingly viewed as critical components of religious life, fostering an environment where all individuals can live free from fear of violence. Buddhism offers another unique perspective on the issue of sexual violence, emphasizing principles of mindfulness, compassion, and the interconnectedness of all beings. The first precept in Buddhism calls for the abstention from harming living beings, and this perspective extends to the understanding of consent and personal autonomy in sexual relationships. The Buddha's teachings encourage practitioners to cultivate compassion, understanding, and respect for others, which inherently rejects the notion of violence in any form, including rape. However, despite these foundational teachings, the cultural contexts in which Buddhism has developed can sometimes complicate responses to sexual violence. In some regions, patriarchal structures have led to a silence around issues of sexual abuse, reinforcing shame and stigma for survivors. But there is a growing movement within Buddhist communities worldwide to confront these issues, fostering a dialogue around consent, healing, and justice. Many Buddhist leaders and practitioners are actively engaging in initiatives to create safe spaces for survivors, emphasizing recovery through mindfulness and compassion. The Sikh faith teaches the inherent equality and dignity of all human beings, grounded in the belief that all individuals are equal in the eyes of the divine. The Guru's teachings emphasize the importance of justice and protection for the vulnerable, delivering a clear message against violence and exploitation. Rape and sexual violence are fundamentally at odds with the Sikh principles of respect, dignity, and community. In contemporary Sikh discourse, there are concerted efforts to address gender-based violence, with community organizations working tirelessly to support survivors and advocate for systemic change. A consistent theme that emerges across these religious perspectives is the need for a proactive response to situations of sexual violence. While theological interpretations provide a critical backdrop, the need for practical, compassionate action is paramount. The voices of survivors must be amplified, and their experiences validated in order for faith communities to effectively address and combat sexual violence. This requires a shift in narrative, recognizing survivors not merely as victims, but as vital contributors to the dialogue around healing and justice. Faith leaders play an essential role in shaping the cultural responses to rape within their communities. By championing an inclusive and empathetic discourse, they can influence attitudes toward gender equality and the normalization of consent in relationships. Educational programs, workshops, and sermons aimed at fostering awareness about sexual violence can contribute fundamentally to shifting the community's understanding and responses to this issue. Furthermore, collaboration between religious communities and secular organizations dedicated to combating violence against women can strengthen efforts to create systemic change. By pooling resources and expertise, a more holistic approach can be developed that addresses not only the immediate needs of survivors but also tackles the societal structures that perpetuate violence. It is crucial for religious communities to acknowledge the diversity of experiences and perspectives within their own ranks. Recognizing intersectionality, how race, class, gender, and cultural background can shape an individual's experience of violence, can enhance the sensitivity and effectiveness of responses. In addition, engaging men in the conversation about sexual violence and gender equality, encouraging accountability, and promoting positive masculinity are vital steps toward fostering a culture of respect and safety for all. In summation, approaching the issue of rape from a religious perspective offers valuable insights into the moral and ethical imperatives that underlie various faith traditions. The unyielding commitment to justice, dignity, and the inherent worth of every individual serves as a guiding principle for addressing the profound suffering inflicted by sexual violence. While challenges remain, the collective efforts of religious communities toward awareness, empathy, and proactive engagement hold the promise of fostering a safer and more just world for all, rooted in the fundamental principles of respect and love that are at the core of many religious teachings. Together, we can forge a future where survivors are heard, justice is pursued, and the sanctity of every person is upheld.